Inflammatory bowel disease, IBD, is a broad term used to describe gastrointestinal disorders characterized by chronic inflammation of the digestive tract that disrupt the body's ability to digest food, absorb nutrients, and eliminate waste. The two most common types of IBD include ulcerative colitis and Crohn's disease. Ulcerative colitis is an immune-mediated disease that affects only the large intestine and rectum. Damaged areas are continuous and confined to the mucosal layer, and histological features include a red, friable mucosa, scattered with ulcers, a loss of goblet cells, crypt distortion, and abscesses. In comparison, Crohn's disease is a transmural disease that can affect any part of the GI tract, from the mouth to the anus. However, the small intestine is most commonly affected. Areas of inflammation are discontinuous and may extend through multiple epithelial layers. Histological features include deep fissuring ulcers, fistulas, and granulomas. Common clinical presentations across both types of IBD include diarrhea, abdominal cramping, fever, fatigue, blood in stool, and unintended weight loss. In Australia, IBD is becoming more severe and prevalent, affecting approximately 1 in 250 people aged between 5 to 40 years old. Australia has one of the highest rates of prevalence in the world, with currently 75,000 Australians suffering with IBD, and this number is predicted to increase to 100,000 by 2022. There is a reduced focus of IBD on ATSI people due to the low prevalence recorded. A study conducted in the Northern Territory estimated a prevalence of 5 cases of IBD per 100,000 Indigenous Australians. Globally, the incidence of IBD is approximately 0.5 to 24.5 cases per 100,000 persons. The prevalence of IBD appears to be higher in countries with a high index of development. For example, in 2017, regions of high income in North America, particularly the USA, contributed to nearly a quarter of total global patients living with IBD. A higher prevalence in developed countries may be attributed to the lack of exposure to common infectious agents during childhood. However, this increased prevalence may also be a result of improved access to diagnostic testing tools, resulting in greater rates of diagnosis. Ulcerative colitis is an idiopathic disease. Each of the following have been hypothesized to be potential causes of ulcerative colitis. However, they each require further research and evidence to be validated. Genetic causes. A genetic predisposition may cause an abnormal immune response when exposed to particular environmental agents. Defects in the HLA-DR103 gene specifically is associated with severe ulcerative colitis. Studies suggest that ulcerative colitis is influenced by genetic inheritance due to higher cases of familial clusterings. Environmental and pathogenic causes. Ulcerative colitis is more common in Western countries such as Australia, Western Europe, and America, suggesting a Western lifestyle may have a role in the development of this disease, potentially due to the lack of exposure to pathogens during childhood, as well as the use of cigarettes, antibiotics, and non-steroidal anti-inflammatories, which may contribute to the damage of epithelia, resulting in a loss of immune tolerance to intestinal antigens. In a healthy individual, the intestinal epithelial cells are interspersed with M cells derived from Peyer's patches, as well as antimicrobial secreting Paneth cells and mucus secreting goblet cells. M cells sample antigens that are present in the lumen, which creates translocation of the microbial peptide, activating immune cells such as macrophages, resulting in a normal immune response. A healthy individual does not produce an immune response to intestinal agents present in the mucosal layer. In ulcerative colitis, genetic and/or environmental factors may trigger damage to the barrier function of the epithelia, leading to a loss of immune tolerance to intestinal antigens. The intestinal microbial product is translocated and immune cells such as macrophages are activated. These antigens are then presented to the CD4 T cells, which will further activate macrophages in the area, as well as tumor necrosis factor, TNFA, interleukin-1 and interleukin-6. The overexpression of inflammatory proteins such as interleukins and cytokines in the colon creates an elevated immune response and overproduction of inflammatory proteins, resulting in chronic inflammation. This may create local complications such as bowel perforation, hemorrhage, and colon cancer, and further systemic complications may result such as conjunctivitis, mouth ulcers, and fatty liver. The different types of ulcerative colitis presented on this slide have differing symptoms due to the location and extent of inflammation. The following are common signs and symptoms observed across most of the types of ulcerative colitis. Bloody diarrhea is a key sign of ulcerative colitis. Chronic colonic inflammation results in frequent bowel contractions and movements, which will be accompanied by symptoms of intense abdominal pain and cramps. In extreme cases, excessive bloody diarrhea may result in anemia due to large amounts of blood loss. Chronic inflammation in the colon may result in ineffective absorption of nutrients. Inability to absorb nutrients may lead to vitamin deficiencies, particularly in B12 and iron, and this may lead to extreme weight loss and potentially anorexia. A combination of incorrect vitamin absorption as well as anemia may contribute to symptoms of extreme fatigue.